Welcome to my show, Musings from 20th Street. My name is Dr. Jane Goldberg. I'm a psychoanalyst, and I am the owner of La Casa de Spa, which is on East 20th Street. Group therapy. And the last session was ended with a question from one of our group members. The question was, when I was complaining about the group not really letting me do, group members asked what I think my job is by answering that question. My job as a group analyst is to facilitate creating an environment in which we can jointly, communally process the experience of being together and process whatever is our life story and whatever our thoughts and feelings are about our life story. And to have all of our thoughts and feelings in relation to that work, the dual work of sharing our life stories and sharing our moment-to-moment experience here in this room together. And what I demand of myself, what I keep asking for myself when I keep complaining that nobody's letting me talk and everybody is screaming at each other and people are just kind of spewing and discharging at each other, I'm actually asking that everybody treat me as respectfully as I want everybody to be treating everybody in the room. So each other, and I don't want people spewing out their feelings. I want people to give breath to everybody's emotional experience. Have whatever their experience is, and to be able to take the time to be able to put it into words, and for us to everybody is just chirping along and clawing at each other to get what they want to say, be the loudest, that we're not being respectful of each other. So with that said, let's see if we can do a better job today of creating that kind of emotional environment that I think is what is needed for this work to be done. Okay, so Shanti, it was your question. What do you think about the answer?
I think it was a great answer. Really. I don't quite know where to go with it, though. I mean, many thoughts came up for me about the way this group is interacting with each other, let alone your role.
Just in hearing your thoughts.
You do know you put me on the spot. You do know that.
She does that all the time.
Everybody is always put on the spot.
Honey, I'm burnt to death. Go for it.
So I'll be the fall guy. All right. I mean,
Yeah.
There's a process that's going on here that seems to me to lack a certain quality of human interaction that I like to see in a group. I mean, I have my visions. And my vision is to say, can we make a distinction between analyzing and empathizing and being non-judgmental? From each other is the same thing, basically. I think we all want to be understood, and I think we also want to be agreed with. Mm-hmm. You know, and there are ways and ways of communicating disagreement that enable us to hear. And I think if we speak somewhat from the soul, you know, from our heart, which all of us really want and need, there's clearly that a need. Mm-hmm. We might have a experience, actually. And I see, you know, when I look at what's going on here, part of me gets pretty emotional. It's like it's a free for all in a sense. It's all for me, and I don't see how I can be healed if I haven't got some feeling of communion from the group. We all are here together for the same damn reason. There's no two ways about it. We all want to be understood. We want to share what we think is the cause of our grief. I may not even agree with this kind of process to come to that conclusion. It's immaterial, because we all have the way we believe we need to be fed emotionally. But let's at least agree that what we're here to do is to help each other as well as ourselves, because when I am healed, I am not healed alone. I'm only healed when there's a joining, because healing is to feel to be healed, you have to no longer be feeling alienated. You need to be united. That's what it's about, being united.
I would like to add to what you're saying as well.
I want to thank you very much for letting me get this off my chest.
No, I agree with you. I agree with everything you said, because I think that has been missing from day one, is also love. And nobody knows the LOVE word.
Including you, Barbara.
Oh, no. You see, I got into. What do you mean include?
Well, you're
Let me go
saying.
for it. Let me go for it. She's allowing me, okay? Is that all right?
Yeah, go ahead.
That's an attack.
Right.
And you don't really mean to do that. It's just...
You know what I think I do at this point, Shanti, to tell you the truth? I've been sitting, trying to work it out with her for the last much longer than you have. The person is just not something I want to be around. Or no.
Does that mean you want to quit the group?
No.
Okay,
But,
I'm certainly not leaving.
cool.
yeah.
Cool.
So I'm done.
But let me...
And you're right, you know.
Yeah, you don't wanna-
let me get into a really
So,
good point.
Shanti, I want to ask you a question.
Please.
Barbara, hold your
She's
thought.
doing it. She's doing it.
Is there something that I could be doing or should be doing that, because I'm in complete agreement with you about the environment that I want to be created here, and that I've been a failure at it.
No, you're struggling with it. You're not a fit. Don't do that to yourself either, please.
I have something to say.
No,
about that.
Wait, let her-
Hold on,
let her
hold
finish.
on.
Let her-
I'm not doing anything to myself that's bad.
No,
just
right.
being nice.
But you're not.
Party,
Don't
right?
say I'm a failure. I'm just
No, I've been a
struggling.
failure in
Well-
that capacity at times in this room.
That's a little
Well,
unrealistic.
okay, but don't be hard on yourself.
I'm not being hard on myself.
Well, okay, if you can handle your criticism,
No problem.
I acknowledge your strength.
I'd like to finish my...
And not
You will.
only
Don't worry about it. I promise.
I never
you.
really do.
not only can I handle it, but I invite discussion about it, because when the group is as it is right now, letting us process this and letting me process this too, then I feel the group is doing exactly what my mission is in the group. But when it's not doing that, I do feel that I'm failing the group, and I am, as you say, I am struggling with how to figure out being a better group analyst to this group of people.
Maybe the word analyst has to be modified. Maybe you are an analyst, and maybe you want to modify it, because analyzing, as I said earlier, my opening statement was making a distinction between analyzing and judging. It's a very, very fine line.
That's right.
And it's an art. And it has to come from the heart. And that's how it's handled. I can play with it with you. I mean, you'll see, you're already providing me an opportunity, so just relax and enjoy it, and we'll play together.
I would like
okay?
to finish my point,
Okay,
because I feel like I was attacked.
You'll get, I promise you. Is that okay if we play together?
Sounds lovely.
Okay, is the group okay about that?
Sure, if I ever finish my point, because I was...
Carol, you're looking a little doubtful.
Fuck it, man. I'm not even going to
You're going to get your chance if
No,
you
you know,
just...
I never do.
you're
because
Everybody's
there's
going to
always
want to
an
take that
attack.
chance, that's for
There's al-
sure.
She
She's
attacks
taking it.
from
She's
day
taking it.
one.
She's taking her
And
chance.
now we're back to day one.
That's loving, isn't it?
We're
Say
back
it
to
again.
day
It's
one.
very loving, isn't it?
Oh, you have not been loving
do I
throughout
detect
this
the
whole
note of
process.
sarcasm?
No, because I was trying to listen to you.
Not Carolyn.
And we can't just
Well,
have a
that's-
love-in. This isn't just a love fest, okay? From
Then
the center.
watch, and let's see how we can work it out.
Obviously, it's not working that
I trust that we
way.
can work it out. I trust that Barbara will relax on this
Good for
a
you.
moment. I
Good
trust.
for you, Sean.
Not with her attacks, I won't.
Yes, you will.
It's constant.
Yes, you will. Yes, you... Shh. Watch. Observe.
40 episodes.
Do you mind if I comment before you do?
Yeah, please do.
Hey, I've got a comment. Possibly it's not as cohesive because
we get new people all the time. That could
That's
be
another
part of it, I think. I think that's part of why, because you say with this group of people, well, this group of people has changed like
Yeah.
every other, and we know that
It's life.
we're supposed to, and that's life. It's
But we could
difficult.
talk about that. That could just
part-
be
kind of
part
why
of
it's
what
difficult.
our emotional experience is that some people have gone and some
True,
people
true.
have come,
True.
and this is how we feel about
Yes. Right.
the new person
Right,
coming.
right.
It doesn't have to create disruption in this work that we have committed to.
But in the groups that you do in your practice, they don't change like that, right? They don't
No,
change.
but it doesn't matter.
Okay.
What
But it's still more
happens in the
difficult, isn't
environment-
it? Isn't it harder?
No.
It's not.
No, if
Is there
if
hatred in your group? Like there is here?
absolutely, absolutely.
And I have a
But
better
there
word.
is not. But there's an understanding that the work only happens when the emotional and internal experience is verbalized, as
Got
opposed
it.
to acting out.
Right.
And it could be aggressive,
if I
and it can be
verbalize it-
I have a
loving,
better
and it
word
can
than
be this.
disruption.
Yeah.
Eruption.
Well, I was trying to make a point to you,
Please, all right, okay.
and then I got attacked in the middle of it.
All right, no,
It's just very
relax.
No, you didn't get attacked. You got shut up.
She felt
You didn't
attacked.
get-
No, I did feel
Oh, yes, you did get
I
attacked.
was
like that.
attacked.
Sorry.
All right.
And I was trying
what's
to
the
make a
point with
point
it?
that what's
Please.
missing in this group is likability factors, empathy, like you said, and any kind of loving feelings. You know, and I'm going to be very honest here. I've been in this group since the very beginning. The only support I feel that I personally have received, that I'm able, and I give what I get. Okay, we all give what we get. I don't yell unless I'm yelled at first, and that's and I never lie, and I never lie because I tell the truth, and maybe that gets me into trouble a lot. But the only
But
people
Barbara, in the last group, I turned to Kay after she attacked you, and I helped her to understand that she was doing that, and I did that in defense of you. So you cannot say truthfully that you are never supported in this room.
Well, all right. I've had my issues, but I mean, steadily, I'm saying it's been these two people, and maybe you occasionally. Sometimes I do feel attacked by you. I'm paranoid, okay, and a lot of it's not paranoia. A lot of it is from the very beginning.
If you're attacked by me, what it is that how you're manifesting your defenses by talking nonstop and perseverating. Do you know the word perseverating?
I have an English degree, and I have no idea what that word is.
Perseverating
Repetitious.
means when you go through
Over and over.
people's boundaries and don't allow them to put the boundary in the space where they want it to be, that you just make the decision about where the boundary should be. And you do that. And when you do that, I do address it. And so I understand that that's a defensive maneuver that you have. And when I address your defenses, you are going to feel attacked because I'm attacking your defenses. And you're identified with your defenses. I understand that. But conceptually, at least, intellectually, I think you can understand the difference. And you should understand the difference because I'm here to help you to heal as everyone else. I don't unfavor you.
Well, I just feel like since the very beginning, you know, the only people who have really tried to get to know me for who I really am, because my intentions are in the right place, my heart is in the right place, but I am not going to have a screaming match with people here. I just don't think that's very helpful.
And it would be really nice if, when you're feeling attacked, that you didn't attack back and create a screaming match.
Well, because I feel I'm lowering myself to their level.
Yes, you are.
Basically.
Yes, you
Yeah,
are. And
I
so
really
be a bigger
am.
man. And now
Well,
I do
yeah,
want to
bigger
hear from
woman,
Carol
yeah,
because
yeah.
you've had looks like I can't read.
I make faces all the time, and I don't mean to. It's involuntary muscles.
Well,
Get a spasm.
Like screaming.
Sure it
it
is.
means that you're feeling something, so,
Well,
or thinking something.
okay, I don't know why I'm here. I've never known why I came. I didn't feel like a patient. I didn't feel like I had a bunch of issues to work on. I know I have issues, but I don't feel especially motivated to work on them, you know? I feel like nobody's perfect, and I don't hate myself for not being perfect, you know? I don't know what to say. But I do feel that one of the reasons I ever started the group is because I like you, and I think it's interesting, this whole process of sharing feelings, verbalizing things. I think it's so intriguing to me. It always has been. I loved psychology classes in school and all that. But this is a new one, and I'm intrigued with it. So when you were talking and saying judgment, or what was the other word?
Analyzing.
Analysis. I think that the analysis is what you are so good at. You know, I think analysis to me is observing and then concluding something about the observation. I mean, correct me if I'm wrong, I don't know what I'm talking about. But
It's good.
that's what I kind of have, that's my impression. And I think you're really good at that. So
There's
to
only
take the
one
analysis out and to.
There's only one thing wrong with what you've done.
Okay.
You, what's the term? When you were brilliant, Carol. What you were saying was really brilliant. And then when you said, you turned back on yourself and said, I don't know what I'm talking about.
Oh.
Don't do that.
Okay. All right.
Because you.
Yeah, because I do like when you told me or I think it was you. I learned from this group, I'm pretty sure it was you, that you gave me permission to fill up my body,
Yes.
you know, and to be a whole woman and be myself. And I think about that sometimes in different situations. And I could tell I was shrinking back just then, and I
Right.
didn't. I would have taken it back right then if I could, but I had already blurted it out. And
Yeah.
that's me, I just blurt
Okay,
stuff out.
do you see how brilliant it is that you got what I said
Yeah.
and that you applied it to your own experience?
Yeah, I feel
You're brilliant.
an improved version of myself. for having Thank you.
Cured at the end of this.
But I think that the analysis part is good, and I've never felt like there was judgment on your part. So I don't think you should even think about you're a failure in any.
So why do you
Part of
think
this.
we're having the problems?
I
with
think
that?
you're
right.
right. I think it's the new people.
Yeah.
Because I'll tell you the truth,
Well, that's only part of it.
I like Walter now, and at first it took me a minute. I like Walter, and when I sit by him, this is going to be kind of mean or embarrassing. Sorry, you spit on me when you talk, and I hate that. But I accept it because I know you and I care about you. Now we have a new guy who
spray?
who spits
Yeah,
on
and the
me.
new
Yeah.
person, I can't
Yeah,
speak.
we
And
spit on me too.
I'm not as forgiving
all the time.
with the new
Because you're
guy.
not right.
But it's all right. I spit on people.
You know what I mean? I haven't invested in the
willingly.
new guy, and so now that
And
he's
we're almost
spitting
done,
on me
and
when
it's
he
a new
talks,
guy
it's
here,
like,
right?
I'm not as forgiving.
What, we have 4 sessions to figure it out with the new guy?
See, so there is something to this. I know you think it's life and it's the way it is, whatever,
discombobulating.
but it really kind of doesn't work.
It doesn't work, no.
No, it works. It all works beautifully if you follow the instruction,
So who's not
which is
following?
whatever your feelings are, to put them into words.
Semantics.
Well, he
To
did.
not
Okay.
say,
It's
to
just
not
like-
say as
Semantics.
Kay and Barbara said, what's he talking about? That's a nasty communication.
Right.
But to say, I'm not following him, I'm kind of not
not even
really, just
motivated
what
to
Carol
follow or
said,
something.
I'm not accepting him,
Right.
I'm not integrating him into this
Right.
experience. I feel like leaving him out. I wish he'd go away.
But is
Those
it fair
are
to say it's
just
a little more difficult, so
It
that's
is
why we're kind of
difficult
having a
because you
tough
start
time?
over
And is that
again.
fair to say?
Gotta start
That
I mean,
is-
it's got to be. That's a little more difficult to do it this way with bringing new people
Yeah.
in because we're obviously having a tougher time.
Well,
What do you mean by
it-
tougher
we
time?
can't
What
even
is
work on
what
the
is the
people
tough
that have been
time? What
here.
time
Well,
is
she
tough?
brought it up as tough
John
time. Right?
is
We can't
good.
figure it out. We're
Figure what
having
out?
a tough.
Because from the very
Being in a-
beginning, we've
being
all
a
had,
group, being a
we've had
cohesive
issues with
group.
each other, and we can't even work those issues out in 40 segments.
That's okay. Life is not supposed
Because
to
no,
be
but
worked
she
out
wants to
like
cure
that.
us by the 48
I wouldn't say
segments.
that.
Everything
I would never
Did you
have
say
an
that?
aspiration of curing. I mean, I'm working with the same patients for 30 years.
Oh, you scared the crap out of me.
Yeah,
you told
that-
me
I
I would
had
like to
somebody
see
like
you
that.
cured by the end of the show.
I
and
didn't
I'm
say
like,
that. I said, Barbara, do you
Okay.
want to be incurable? I'm not even beginning to try to cure you.
No,
I don't,
that would be another 40
I don't even
years.
know whether you want to be cured.
Oh, yeah, I do want to be cured. If you're used to being sick, though, from the, when you come out of the womb.
Okay, my conclusion is that you don't want to be cured, and the reason why, I'm feeling a little more optimistic about Walter. The reason why I say that is because when somebody wants to be cured, they cooperate with the therapy. So when you cooperate with the therapy, you asked me, a couple of sessions ago about whether I love you. I said, I'll love you when you cooperate with me. Every time you cooperate with me, by really saying how you think and feel and bringing it into the group process, I love you. And then I have hope for your being cured. But when all you're doing is, throwing out words, then
Well, Walter's
It
been
works
doing that
within
for
limits.
a long
It
time.
works
But
within
today-
limits.
What is it called? Hyperbole? Is that it? People just talking in.
well, hyperbole just means that you exaggerate.
No, I
It-
don't.
Well,
it
there is a
works
lot of
within
that.
limits.
Hyperbole is like this. Is that what
Oh
you're thinking
yeah,
of?
Kay, you wanted to
mathematics?
say something?
Yeah, I wanted to. The video thing that we had last time,
The
we
argument
we
about the-
argued. he didn't actually take a video camera, put it in his pocket. It wasn't video, because it would have been impossible not to do that consciously, to take out a video camera while you're pumping somebody's chest and film it, okay?
No,
it was
it's
actually an
this.
audio
It was this.
recorder that
I know it
was,
was audio
in his
too.
pocket.
We knew that.
Oh, I thought it was a
Yeah,
video.
it
It was in my vest, and I
I
had
said it's
He said audio.
impossible.
No, it was audio.
Okay.
Audio,
okay.
yeah.
So
He said
I
audio.
apologize.
That's
Okay,
okay. I understand.
I'm sorry.
It's
Okay, I want to just say, John,
Yes.
it's just a verbal therapy, so we don't pull out toys and
Okay.
demonstrate, so put it back.
All right.
And
not on
Got some
now, is
very
it?
interesting toys.
so whatever compelling you're going to have to do to get Kay to really understand what happened, you're going to have to do it in words.
Okay.
But anyway, it sounds like it's already done.
Jane,
I accept your apology.
What you do.
Okay, now I don't know whether to listen to Josh or Walter right now. And Barbara's laughing is kind of distracting me from doing
No,
either.
I'm sort of.
And Walter, I wasn't saying that to give Walter
I am
to
taking-
give Josh the floor. I was saying that because I truly did not know who I should be listening to at that moment. So I see you're deferring to Josh.
I thought he was going, but I've been vying for a few minutes now before Josh came in, and I guess I'm guilty of competing now. So I'd like to be heard about something I've heard related to here. And
So is that
what
okay with you,
said
Josh?
Yeah.
Is that okay
It's
with you?
okay.
Thanks, Josh.
Fine.
And also, it's about what you said at your opening speech at the beginning. I think this does work, your mode, within limits, which could be put in different terms. But that, to me, I've given some thought to this between sessions. This still, it leaves areas that don't quite get handled. I've been trying to put it in the context of the therapy I believe in, like handling anger with the interaction where people really communicate with each other and, like maybe say the words, I'm mad at you, I'm angry at you, and communicate directly. That's good.
Is he morphing Paul?
Oh, hell yeah.
Yeah.
Paul is alive and well, ladies.
Actually, he committed suicide.
Do you understand why I said that? Because it sounds like you're trying to engage me in an intellectual conversation about whether my treatment is better than your idea of treatment or blah, blah,
Paul
blah.
is dead.
Well, if it stays intellectual,
Paul is
for
dead.
any interval,
Like the Beatles.
intellectual,
it
as
was
in
intellectual.
disconnected from feelings. I don't want it to stay that way.
Good.
But
Me
it
neither.
may for moments. I mean, sometimes I have to just saw it that way. So I'm saying that I've been trying to put in the context of what I'm most used to, which is the deep catharsis that I see in primal therapy, which does include the kind of work that you do at times. People communicating. And I'm just feeling that it really has to be taken account for that. We are going to get some. If we do your mode here, we're going to get some. But I think if we really do your mode beautifully, we're gonna reach the point where we see its limits, and then we're gonna feel some frustration, like, oh yeah, this doesn't go all the way there. But it's been good, I mean, there'll be satisfaction too.
Okay, thank you.
Walter, can I ask you a question?
That's about it.
Can I ask Walter a question?
I want to
As
ask
long as
you
you're
a
not touching.
question.
No,
Dee,
okay. I won't.
Dee, what did
Yeah.
I do? You know the video cam? Sorry.
It's okay. Just go ahead.
The video camera thing where you heard the story from John, and I heard. What did I do?
Remember when I was sitting here and
Yeah, and he said, and you heard that he had the recorder, that it was a voice.
Yes.
Yeah.
Some reason I didn't.
He said,
And I'm wondering
Maybe
if
because everybody
I'm
was yelling
doing something,
at once.
if there's something that on with my
Everybody was
perception
talking.
that I might be doing.
Remember when he explained why he said it was it felt like it was forever, blah blah blah.
Right,
based on
right,
the
right,
song.
right.
Well, then that would have had to be because he said what he heard. So that's audio.
No, but the thing is, you were accused of
He was
telling
talking
the
all about
story. That was the way.
Audio. He never talked about video.
Well, I thought, but
Well, okay, I
what
think
in my
what-
perception?
I think
I'm
what you-
asking in my perception of things.
What you
why
did-
would mine be different than
what-
his, and if his be accurate, mine not be accurate?
What you did, I
I'm
think,
wondering
is
if
what
I do
with-
that. Go ahead.
Okay, that was nasty.
No, I'm just saying, like, we were progressing. We always keep going back.
But she's asking a question about her own process, and you're saying she shouldn't, and let's just jump to
Well, because,
something
you know,
else.
he
Because
was
it involved
basically-
somebody new like me, and she's already had experience with the others, and she felt concerned. right?
And I wouldn't want to
'Cause-
do that to you
No,
again,
because I'm the same
John.
way, right?
You know
if
what I
I'm
mean?
right, if I make
And
misunderstand
maybe
you.
in my regular life, I'm doing that in other cases and not seeing
No,
that
I've
my
done that
perception
too.
is off.
I've jumped to
why-
conclusions.
so why-
that,
I wanna
you
know.
I've
Why
misunderstood.
would you not be interested
Right,
in
yeah.
helping Kate
That's
to
okay. I
understand
knew you understood.
something that
I
she's
didn't,
interested
you know, it was just a
in
TV show.
looking at about
Because
herself?
everybody here has been attacked in some way by Kay, and needlessly.
So let's punish her.
No, it's
Yes.
not a matter of punishment. It's a matter of
What is it?
I mean, Dee and I
feels like
heard what he
punishment.
said, and it wasn't a big thing. And
There's a whole lot of territory to
Why
cover.
would
man
she
died?
did-
There's a whole lot of
Man
territory to
died?
cover.
I'm wondering if
so-
that.
No, no,
I'm
no,
wondering
no,
if I
no.
do that in regular life
Possible.
and just miss it because you're not there in my regular life to say,
Oh, you're
oh, it was
right.
or correct me, or to have like John the patience to
Right.
go over it with me afterward. So if I left this room with my perception
Yeah.
of your
I know you'll be
actions,
happy.
I would
would
be
feel-
considering my judgment of your character would be
Would be
different.
completely
Would be more
than if it
positive.
would be if you filmed
Right,
the
and
whole
I would feel
videotape.
better
Right.
knowing
Okay.
that you walked out of here
The
knowing
answer
the
is
truth.
yes.
Right? Exactly.
The answer is yes, you are doing that
Right.
in your life
Yeah.
because I've seen
Yes.
you do it in this room.
She's going to walk out
But-
here with a clear conscience.
But
Yes, it
but
worries
it's
me. It
but
worries
it-
me.
But it's difficult for me to get into that with you with Barbara saying that you shouldn't have the attention.
That's not what I said. Shit. What is the? You know, things
But
are
it's the way
made
you
up
reacted,
here.
though, sweetie. But you reacted in that way. That
No,
she
no.
shouldn't
You know
have.
what? It's everything.
Can
is-
you listen? Can you listen to your friend?
You kind of
Since
did.
you won't
No,
listen
you
to
kind of
me.
did, really. No, you did. The way you reacted meant it said we don't want to listen to Kay. That's what it projected.
Well,
Can you hear? He called you sweetie. Can you hear from your sweetie? Can
It
you
kinda
really?
did.
Can
It
you
really
really?
Can I commit suicide on television?
Come
Is that
on,
allowed?
You have to go like this.
That'll make good, great ratings.
Can somebody say something to you about your functioning where instead of feeling attacked, you can feel that they're really trying to help you understand something about yourself? Can you have that experience with Dee right now?
I'm so confused about today and this shit that's going on today. I feel like we're back to
Jane, I
one.
just
want to figure-
I think John-
Maybe we have to go back to square one at
Having
points.
myself Is part of the
In order
danger
to
thing,
make
the perception.
Yes.
progress.
When you said I perceive
Yes.
danger when there is
Yes.
none. So
Yes.
this is what I'm doing.
Yes.
Creating
Yes.
how, and I'm blocking out something and not
Yes.
linking it together.
Yes.
Yeah.
So okay, so I'm knowing that should help me be a help because it's
Josh
not good to do that.
Right.
You're creating, when you're taking reality, you're skewering it,
Right.
and you're coming away with
You're-
conclusions that are wrong.
Yes, and you're creating conflict when it's unnecessary.
Right.
So that's cool, isn't it? She's trying to figure it out.
Right.
I'm trying to figure out a lot of
positive
things at
thing.
this point. and
create
I'm
the
confused by a lot.
Josh? What was Josh? Were you going to say something?
Well, look, there's an inside story going on here, but I admire Jane because this is quite complex situation. There are people here who are very much into their feelings and emotions. There are others of us who are trying to be philosophical, like Shanti, and there are some of us who are being condescending, like Barbara, who says that she can come down to our level or whatever.
I don't
the
agree
heck
with that at
she
all.
was talking.
Honey, that
I
wasn't
think
that's complete
condescension.
bullshit. I think
That's
that's
bullshit.
At the
Okay,
same
Josh, I'm going to
time,
stop you
It's his
because
I don't
perception.
know.
It's
Josh,
his
Josh,
perception. You don't have to
I
agree
need to
with it.
stop you, and I need to stop Barbara and everybody else because this group has come to an end. But I do need to point out to you that calling Barbara condescending
Yeah, that's
is an
wrong.
attack.
Yeah. That was kind of
And so we need to help you to do better. And Barbara, you need to recognize that once again I
I'm
just
being
offended
attacked.
you.
Thank you. I can use it. I'm getting
No,
a
I don't want you to.
complex.
Yes, recognize that you're being attacked, but more importantly, recognize that I defended
Defended
you.
you.
Take out the knives. You know.
How about take out the cotton candy?